Good afternoon, everyone, and thank you very much for joining us. My name is Louise Christie. I'm with Scottish Recovery Network. I've worked there for quite a few years now, and have been also personally involved in the work in Dundee. We're delighted to be sharing the experiences and learning from Making Recovery Real in Dundee with you today. Very briefly, Scottish Recovery Network's a small national organisation, and we promote and support recovery approaches and services in communities. We launched Making Recovery Real in 2015, and it was a bit of a departure for us. So the aim was to work in an area, bringing people together so they could decide what would make recovery a day-to-day part of services and supports in their area. Rather than us taking a solution into an area and trying to get people to pilot it. Underpinning this was the desire that lived experience should be at the centre of mental health policy and practice, and also for there to be an approach that was about collaboration and co-production, where we all went on that journey to discover what recovery would look like, not just personally, but for organisations and services locally. So joining me today to share their experiences of Making Recovery Real in Dundee are Ruth Brown, who's the team leader for mental health and engagement involvement at Dundee Volunteer and Voluntary Action, the local third sector initiative. Ruth is also the chair of the Making Recovery Real in Dundee Partners Group and has been involved right from the very beginning. We also have Wendy Callender, who's the executive director of Wellbeing Works, a local mental health organisation that has been involved in Making Recovery Real in Dundee again from the very beginning, and particularly actively since Wendy came on board. Also from Wellbeing Works, we have Scott Oram, who's a relatively new peer worker, who came into post, we were saying, just 26 days before the first lockdown, but is part of the developments that Making Recovery Real has led to, which is more peer workers. And we've also got Rona Foy, who's been involved in Making Recovery Real Dundee from the very beginning, was one of our stars in our Recovery Stories film, and is also a peer volunteer in a number of local organisations and services, which you'll hear more about. So to get us started, I think I'm sure you're fed up listening to me, and I think it's now time to hear from people in Dundee themselves. So I'm going to start off by asking Ruth to tell us a bit about Making Recovery Real in Dundee.
Thanks, Louise. So Making Recovery Real in Dundee is an initiative that brings together people with lived experience of mental health challenges and mental health recovery, people who work in local organisations and services, and it's about bringing those people together so that we can change the way we plan, design and deliver mental health services and supports. We've had a lot of large-scale events prior to lockdown. We've had a lot of small working groups, and we always try and mix all those different people with different perspectives when we get together. In our early work, we brought people together just to think about recovery and what it meant to them. And we did that a number of times before we started to really hone down the information we were gathering and to identify the priorities emerging from that. And the things that we began to focus on were work around sharing recovery stories, peer support, and how ordinary people make recovery happen for themselves and for other people. As Louise said, we developed a recovery stories film. We established a network for people with an interest and an active involvement in peer recovery, and we have been gradually increasing peer recovery roles in services and organisations, both paid roles and volunteering roles, and informal roles in communities. The initiative's been going for over 5 years now, and we've got to the stage where the work that we do is a key part of the strategic planning in Dundee, and Making Recovery Real and its work is included both in the city plan and in the mental health strategic plan, and also connects with a number of other strategic planning forums in the city. And it's provided a basis for ongoing collaboration and development of recovery work in the city. And that is a broad brush overview of what we've been doing.
Thanks very much, Ruth. I thought I would hand over to Wendy now to tell us a bit about about the story briefly of Wellbeing Works, how you've developed, and some of your recent activities just before and after the COVID-19 pandemic hit.
Okay, thanks, Louise. So Wellbeing Works has been around in Dundee for more than 50 years, probably nearer 60 years, but up until a couple of years ago was better known as Dundee Association for Mental Health. So we've gone through quite a period of change. We've rebranded and we've had a wee shake-up of our staff group, we've had a shake-up of our programmes, really just trying to reflect what people want and need in terms of support for mental health in our community. So generally speaking, before COVID landed, our activity programme was really focused around just activities. So it might be arts and crafts or music or gardening or local history, which is all very group focused and about working together. And obviously COVID's come along and kind of knocked that on the head a wee bit for us, which has been a bit of a challenge. But an interesting development for us just at the end of last year was we secured some funding through and with support from Making Recovery Real and from Scottish Recovery Network to be able to put together an application for paid posts in peer work. And while we've known the benefits of peer support for a long time and have had peer volunteers for a long time, so the opportunity to be able to create some paid roles in our organisation was a very exciting thing. So we now have, on top of our team of 3 support workers, we also have a team of peer workers that consists of a full-time development worker and 3 part-time paid peer workers. And what that means for us is that we've got a team who are solely focused on helping people to engage with our service, to be included and attend and participate and get as much as they can out of being part of our service, and where appropriate to progress on and follow their goals and dreams. So fabulous to have a resource where that's their focus. So yeah, that's the whistle-stop tour, Louise.
Thank you very much, Wendy. Well, you mentioned your new team of peer workers, so I'd like to bring in Scott. Now I know that maybe what you've been doing wasn't what you envisaged doing when you first took up post, but it'd be helpful to know a little bit about what you have been doing in your role as peer worker over the last few months.
Thanks, Louise. Yes, I started just before the lockdown. Basically, what I've been doing since the start of the lockdown was I've been helping on the Making Recovery Real telephone lines, just taking calls as they obviously come in, whether they came in from flyers or on the media, on websites or the like. From there, being able to put people on forward people on just the one-to-one calls initially, and then progressing into the system where they can carry out in activities and the like, and that's where we're progressing from there.
Thanks very much, Scott. I'd also like to ask Rona, I mean, things may have been different over the last few months, but you're somebody who's been involved in your volunteering quite a lot.
Mm-hmm.
So if you can just tell us a bit about that.
Hi Louise, thanks. Yeah, I've been involved with Making Recovery Real for 5 years now, since the beginning. And I've just been volunteer for like recovery at Dundonald, and I unfortunately, because of COVID, we couldn't go to recovery at Dundonald. That's been shut down just now. But I've been doing up at Nine Wells Hospital. I've been doing helping up there, and that as a key worker. So yeah, I really enjoy that. Yeah.
Thank you.
Anything else, Louise? Sorry.
Well, I just a bit about a wee bit about the type of work you're doing, just with people.
Yeah. At recovery at Dundonald, I was a peer support worker, and like just help speak to clients and that, and help to give them confidence and let them know that we're there for them, and get involved in different things. Help them. I work alongside up there, I volunteer alongside occupational therapists and things like that. And there's a group of that help the clients. And I myself had anxiety and depression years ago, and was there. So to be able to help them now, you know, is like giving something back. It's fantastic. And making recovery reels helped me build my confidence in that over the years. And that, so yes, it's been great. At the moment, I'm up at Nine Wells Hospital, like I said, and it's just like going around the wards delivering papers and things because, like I said, because of COVID, unfortunately, recovery at Dundonald's closed at the moment.
Thank you very much, Rona.
You're welcome.
So I'm just going to open up to our panel and ask, you know, so what do you think is working well making Recovery Real Dundee? You know, what would you share with the people who are listening in? What's made these things happen? On you go, Ruth.
I would say one of the things that's been really important in making things happen has been the strategic links we've had, because we've had well, the strategic links, but also the overall co-production approach, because we've been bringing together people from different roles in creating good mental health for everyone. That's enabled us to have just relaxed and open conversations with people that previously we might have had only very business-like conversations, for example, with commissioners and with the chair of our strategic planning groups. So we've been able to include them as equals in the work that we're doing. And I think that has really been an eye-opener for everybody. So in doing that, we've really built more equal relationships, and we've gained more respect. Third sector organisations have gained more respect. Individual participants have gained respect and recognition for the assets and the things that they can bring to improving mental health in the city. So it's really raised the profile of the strengths that individuals have and communities have in terms of improving mental health for everyone. So for me, that's been really key, and such that, as Wendy said, we got quite a considerable investment in growing peer recovery across the city, from which a number of third sector organisations have benefited, and we've also got the beginnings of establishing some additional paid roles within statutory services, including our mental health officer team. So they're quite significant changes, because previously mental health was very much about the clinical interventions and not much recognition really given to what went on at personal and community level.
Yeah, yes, Wendy?
I would just add to that by saying the fact that several of the Making Recovery Real partners have been able to create paid roles for people, and the fact that that's happened kind of all within quite a short time frame, it's meant that this it's like a whole new team of peer workers have come into the sector and are learning together and supporting each other. And I think that really brings a really strong foundation to peer work in Dundee. So yeah, I'm excited about how far it can go, to be honest. It feels such a positive thing.
Well, that sort of brings me to our last question, is what is next? So what's next for Making Recovery Real in Dundee?
I'll have a go. Can I take that one, Louise?
Yes, you can.
I think just where Dundee is at the moment in terms of mental health and wellbeing strategies, and just the link between services and the link between the Health and Social Care Partnership and the third sector. It feels like a really exciting time, and I know it's been put on hold a bit, like everything else in the world over recent months. But I think building on really strong relationships between partners within Making Recovery Real and with the Health and Social Care Partnership and statutory organisations, it's an exciting time. I can see lots of new development coming, and I think the strength that we have in Making Recovery Real in that partnership, I think that positions us really well in terms of taking up some of the opportunities that might come along in the strategies and plans.
Thank you. Thanks, Wendy. Rona, you were going to say something?
I was just going to say, the good thing about Making Recovery Real is it's a good network of people, and also anyone can get involved, you know, from different places. So it's good for and then come together and that, yeah. So
Thank you.
Yeah.
And Ruth, you were like to say something?
Yeah, one of the things that's always going to be next now is an expectation that whatever changes take place, there needs to be a good element of co-production in it, and that's a significant turn. So we have quite a lot of work ongoing to redesign, for example, different care pathways, to think about what kind of responses are available to people in different situations. And I think there's a real expectation now that when we're redesigning or thinking about what different kinds and better kinds of supports there should be, those will be co-produced with lived experience central to that co-production. Whereas previously there might have been a bit of a temptation or an inclination to for people who work in services to come up with ideas and consult on them. I think there's more of an expectation now that we go as a first point of call to people we know have their own lived experience of these situations, and ask them what would have made this better for you. How can the future be brighter for people facing those situations and circumstances now?
Thank you. Scott?
I think perhaps what I want to say is that it's now we're in a position where we can start to go into the community on a face-to-face basis and to just make the more communication, make more involvement with participants as well as employees, just to help in the community to get people better, hopefully.
Thank you. So you've got all of that to look forward to as we move out of and hopefully onward from the recent lockdowns. So we've now we've got a couple of questions in. So our audience has been definitely listening, which is brilliant. So I've got a question posed by one of our audience, our attendees. And they said, have you experienced a lack of a cohesive approach with organisations and mental health staff not working in collaboration with others? So I think, and with others passionate about mental health and well-being. So they're asking is, what challenges did you face in getting people together, and what obstacles were there to collaboration? Anybody want to pick that one up? Thanks, Ruth.
Yeah, Yeah, that's always there, and I think particularly when people have invested a lifetime in a particular health discipline, for example, it can be that can create blinkers. It's not a deliberate thing; it's just a thing that happens over time. But the nature of the work that we've done with Making Recovery Real, bringing people together and emphasising that we're all of equal value in this. Our experiences are different, but they're of equal value. And that's something we always emphasise. So you may be a psychiatrist, you may be someone who does not have the confidence to speak to anyone. Your contributions are equal, and we find ways of supporting everyone to make a contribution and to communicate their views, and we mix those all together. So so yeah, there have been difficulties, and there always will be, but right from the start we said that this was about shifting the balance towards people with lived experience of mental health recovery. And so that's what we continue to emphasise.
Thank you. Can I also add to that, as somebody who is coming from a national organisation and working closely with people in Dundee, was that one of the things we did was not let the fact that some people were struggling to engage with what we were doing hold us back. We just kept going. And I'm sure it comes as no surprise to some of you that some of our colleagues, particularly in the NHS and in inpatient services, found this way of working quite challenging. But what we have done is just keep going and keep the confidence and keep promoting this way of working. And we have found those barriers to break down more. I think it also has allowed us to maybe more politely challenge the more traditional ways of working and show people the alternative. So I think if you're having difficulties, find out who's willing to be around the table at that time, who's willing to come together and work with them. And it does, that can bring other people round. So you don't need to wait on everyone. What you do need is people with lived experience and people who want to do this. So hope that makes some sense.
Well, recognising that mental health challenges affect all of us at some point and to some degree in our lives, and that we were all bringing vulnerabilities and we were all bringing assets, and working with all of those things.
Anyone? We've also got another question. So how have you found bringing people together in digital, have you found bringing people together in digital platforms difficult? And how has this been overcome?
I can say something about that. We have found for our participant group, having to engage on digital platforms is really quite a challenge. There are some people who are very adept and comfortable in this kind of environment, and there are other people who are just not. And I think the important thing is that you need to find a way you need to find what's the comfort zone of the person that you're trying to communicate with and communicate in their way, so that you don't leave anybody out. You just need to find different ways. So I know from my organization's point of view, we're doing some stuff through digital platforms. We're doing some stuff through things like WhatsApp or telephone messaging. We're using texting, we're using calls, we're using any and all means of communicating just because it's what's required.
There's also been, yeah, I agree with Wendy, all those challenges are definitely there for us. But strangely, we also found that for some people, digital engagement seemed to bring people closer together. And actually, a core group of people within the network have really flourished using digital communication, because for some people it removes some of the barriers and discomforts of having to be in the same room as others. So I guess it's had its swings and roundabouts, and going forward, we're going to be continuing to use all our best ways of communicating with people. We will be, one of the challenges is how we have those big scale, large scale events with 70 or 80 people in a room that we all so much enjoyed. And that's a challenge we're starting to work on now, what we can do that can meet the same outcomes, but will be COVID safe.
Thank you. I think that's the questions at the moment. I'll say, has anybody out there got any other questions or anything they'd like to pose to us? I don't think so. So has any of you got any last words to share with people about you know, your experience of making recovery real in Dundee and what's happening now? Rona, on you go.
Yeah, I've went from doing groups with people and things and making recovery real, going back, like I said, 5 years ago, from then going on to facilitate peer-to-peer groups, doing interviews myself, interviewing people for jobs and things like that, going to around different places, exhibitions and things where you get, it's been fantastic. And just from where I started to now, it's just, you know, it's been a lot, and it's helped me a lot, you know, I've came a long way.
Thank you. Thanks, Rona.
You know.
Yes, Scott?
I think for Rona, for the same place, I've been able to start learning different things that I can do, actually. I've been studying, I'm doing a PDA just now, just to further my knowledge and to help to self to move forward in helping people.
Thank you. So I think I can also reflect that the personal journeys of people involved in making recovery real are not just people who were there for their lived experiences. As Ruth mentioned, that many of the practitioners there recognised that they were bringing their lived experience as well as their professional experience to the table. I think that was one of the things that really helped create that equality in the room. And now we're moving to equality in the room on the screen. It's about how we take those principles and work on it. I'd just like to thank Ruth, Wendy, Rona and Scott very much for taking part this afternoon. It's been my pleasure and privilege to work with them over the last 5 years, and I have missed being with them in person. But we will, as Nick said, we will be sending you an email after this, and we'll send you a link to a spot on our website where you will find reports about making recovery real in Dundee, but also a film where some of the people here talk about their experiences, and also a link to the Recovery Stories film that I mentioned and Ruth and Rona. So I'd just like to thank you all very much, wish you all the best, and if you are interested, please feel free to get in touch to discuss, because we are certainly keen to work like this in other areas. Thank you.
Yes, thank you to Louise and everyone in our panel for providing those insights today, and everyone watching and interacting as well. Thank you for your insights. And so just to now sign off, if you have a piece of work or campaign that you would like to highlight yourselves, please contact the Alliance Live team to discuss how this activity could help. So email live@alliance-scotland.org.uk or visit www.alliance-scotland.org.uk/Alliance Live. Once again, a final big thank you to everyone watching today, and have a great day. Thank you.
Thanks very much, Nick. Thank you.